Yeah, Rohit, go on.
So good morning, sir. So what I've done is I've actually merged the woman power and the starting lineup PPT into one. So I omit the redundancy out. Uh, so the speakers that will be talking in this particular session are Dr. Matilda, who will also guide the panel discussion. Then there'll be Dr. Khyati Vakaria, who will be talking on menstruation in female athletes. Then there'll be Miss Alifia Wagh, who will be talking about social challenges in hashtag #MeToo movement. This will be followed by Mr. Anil Ramchandran talking about gender identity, along with Dr. Harsha slash Dr. Harini Muralidharan talking about the female athletic triad. Dr. Matilda and Dr. Khyati, small bio angel is going to provide me today. So after that happens, once Dr. Khyati comes on stage, she'll be talking about menstruation. So I've made a small video. This is Duty Chand. We all know Duty Chand, the athlete in India, about menstruation and the period cramps and how a female athlete deals with. So when this video is being played on, Dr. Khyati will go on elaborating about her talk and pointing out few intricate details as to how one can go about having a female body and or a female teammate and going about with their menstruation, their health related problems and stuff. So I'll just let the whole video play. But these videos that are for 2 to 3 minutes only. Next, after the menstruation
But
session,
there's no voice in that video.
no, sir, I've purposely muted so that I've purposely cut off the voice so that Khyati ma'am or the speaker they can talk about it. That is why I've removed the voice
Okay.
from the videos.
No, Kathy said she will get a video. We can
Okay.
use video.
Okay,
Uh,
sir.
Probably have voice. Start, but we'll see what Kathy brings.
Okay, sir.
We can put this after that or before that.
No problem, no problem. So the videos that I've done, I've purposely muted everyone's voice because I want the speaker to be eminent rather than the video being eminent. So the video should be playing in the background, and the speaker, he or she will be the main focus of attention.
There are subtitles, then it's fine. If there are no subtitles, then there's no point. Okay, go on, go on. We'll see.
Yes. Next will be Miss Alifia Wagh. She's from Mysore, has won gold medals in the following categories in squat, bench press, deadlift, etc. She has won gold medal in the National Classic Senior Powerlifting Championships as well. And City Athlete has secured bronze under 72 kgs category in the Masters and also in deadlift and multiple awards she's won. So she'll be talking about social challenges in the hashtag #MeToo movement. These are all the videos of those eminent female athletes who have witnessed or had played some part in the hashtag movement, not just in India but abroad and in other countries as well. So Miss Alifia Wagh will share a light on this, and she'll be talking about how one can go about, preventing this particular incident from happening, or what is the way out, or how a female should be treated, so that these moments are exempted from happening. So.
Yeah, one of the Indian athletes, why only Vellakari boss?
So I got the videos that were there for that, so for hashtag
Oh,
ones.
there are plenty of Indians.
Okay, sir.
Let it be relevant and, kind of Indian meeting.
Fine, so I'll change that video, sir.
Plenty. Recently, the Bridge Bush incident and all that. So many. And our audience will be able to identify with that. And then next, the nomenclature. Have you finished the nomenclature?
So the speakers, the number of, I've merged the whole thing into one, sir. So I have 5 speakers, and I've introduced one speaker. Then that particular speaker will be talking about this. So I'm playing the video and then moving on to the next speaker.
I'm not talking about that. See, we decided to have a few key words which are used in each session to quickly mention and the meaning of it, because a lot of them will be there wondering what the hell you are talking about, me too, or whatever. And at such technical term, we had decided if Dr. Santosh agrees, that can be done.
Yeah, you have any terms for this session, Rohit?
No, sir.
No, do you know what we are talking about?
So we'll add that. For example, me too, hashtag me too. Everybody might not understand hashtag me too. So that when during the start of the program, I mean the session, you put up a hashtag me too, then show Facebook and say me too means actually this. So
Okay,
that's
sir.
the meaning of me too. Something like that. You can talk about. We had a class to identify those terms, right? You have got a list of terms which is
Sir,
relevant to this session.
that time I was not in that group, sir.
Okay, we'll add at least 4 terms.
Yes.
Okay, go on with this term.
There are a lot of colloquial terms the athletes use among themselves, periods and things like that.
Okay, sir.
And the female physiotherapist should be very familiar with it. You can get some information from it.
Right, sir. Then
Rohit.
Mr. Anil Ramchandran will be coming. He's the professor and dean of School of Physical Education and Sports Sciences in Kannur. He's a former director of Research and Development Cell in Kannur. He's an educationalist with 28 years of experience in the interest of curriculum designing, pedagogy, parenting, counseling, and sports sciences. He's an invited speaker at more than 200 national and international conferences with presentations at World Congress, Sydney, Australia, Beijing, China, and multiple other countries. He's a motivational speaker and mentor. He is a part of the Research Superior Group, which specializes and focuses on research in exercise physiology, load monitoring, recovery science, etc. He's a Secretary General of the Sports Psychology Association of India. He's a recipient of the Badminton World Federation Award grant, invited speaker at the BWF World Coaching Conference at Basel in Copenhagen. He's a badminton player who represented India in the World Masters in Korea. He's also a badminton coach, mentored nationally and international players. So he will be talking about gender identity. This is a video where gender identity is being emphasized and how males and females are looked differently, and how trans females athletes have gotten into female sports and how that is affecting the female athletic sporting world today. Many of the trans athletes have changed their gender and are competing with females, but the IOC, the International Olympic Committee, is not clear. They don't have clear guidelines on this because their bodies, what they say is their body is already developed because of the testosterone and the other male hormones. So even if you decrease the level of testosterone later on, the muscles and the bone structure is already developed. So the performance is already enhanced when it comes to trans athletes compared to female athletes. So many of these athletes, many of the athletic bodies have put a ban on trans athletes performing or taking part or participating in female athletic events. Few of these are allowed, but majority of them have given, the IOC has given independent bodies to decide whether what guidelines and what SOPs should be followed when it comes to a trans athlete who's trying to compete in a female athletic world. So from a trans athlete's point of view, they are saying that we are females. We were originally males, but we have transformed to females, and it is our right, since we are females, to participate in female athletic competitions. So it's kind of a gray zone. Nobody knows what's going to happen with this. So the onus actually lies on the International Olympic Committee. But what they've done is they've just distributed that particular responsibility on individual sporting bodies, like say swimming, cycling, and letting them decide the fate of that particular sporting event. After this,
Santosh, do you want the introduction?
Sir?
Like the Hariksha and all the 20 sentences to be read?
No, we have to cut down. I'll elaborate, sir. Rohit,
Yes.
this aspect of go to the previous this thing. Let's ask Kiati to talk about this, and Matilda also to talk about this, whatever you were talking.
Okay.
And that is the treatment what Paul was mentioning, right? Hormone therapy.
Right, sir.
So that also you need to create a video on what is that therapy.
Okay, sir.
And regarding the terminologies, gender identity itself explanation and Tamil translation of transgender. We'll ask the help of Matilda.
Yes, sir.
Tamil. So I mean, whatever we say will not understood, will not be understood by the crowd because it's not in Tamil. So
Right, sir.
Tamil translation of these terms are very important.
Right, sir.
So terminology wise, transgender is one more, Me Too is one. So we'll keep
Right.
adding that.
Fine, sir.
Go to that next slide. This is Vinci is there with us. Vinci, these are the entire details, but when we project there, this is just for the information. This is the script and the sequence within which we are going to go in that session. But these slides would be projected just with 4 lines during the changeover. When the previous session is over and then this session starts, these slides would be put up and you would be inviting these speakers onto the stage. So this is an information which you would get from us, but on the screen only few lines would be there. So you have to filter and prepare, and we will take it forward from that. And they should be introduced and brought to the stage. After that, this will not be projected onto the LED during the session. Vinci, am I clear?
Yes, sir. Yes, I'm listening to you.
So this
So,
all
like,
this information is for you, but we have to filter it out, and you have to help us filtering it out also.
will I
See,
get this
Vinci
in
needs-
my mail, sir? Like somebody sending me in mail, I guess, email. So this is, I get it as a mail.
So I was in the impression already you have received the mail. Okay, I'll ask Angel is the person.
Okay.
The person you
Sorry,
saw
maybe I'll
the
just
mail,
check it out. Okay.
she would have sent you the mail already.
Yeah, I got a name list in as per the PDF. I'll just check it, sir. Thank you.
Ah.
Thank you. I'll do it.
Okay.
See, Vinci will need some help to highlight which point to highlight, which point not to highlight. Because there are some people like this, Anand Natarajan and all, they're very particular about the one particular thing. And I think, when you project the whole thing, but highlight only point which they want to highlight. And Vinci also can highlight on those points.
Yes, sir, because it seems to be like all the points are key points, and I feel like each line is kind of information. So, like, I don't know which to filter. Somebody can assist me on this. I will definitely do it as per their needs, sir.
Yeah, first you go through all the list, Vinci. So we'll after you go through all of them, we'll sit together and
Okay.
highlight the points. So Thursday you have to have a rehearsal of how you are going to present. So you first go through that and let me know when you're ready. We'll sit through that again. We can do that online also.
All right, sir. Okay, sir. Thank you. Okay.
Okay.
Yes, sir. So coming back to this, Dr. Woody.
Harsha's picture has, this is not Harsha. You have to
So,
change
sir,
it.
this is not Harsha. So this Harsha is not coming at all. Some different Harsha PS is there. Yesterday only I got her information. I'll pass on to the fellows, sir.
Okay.
Then Dr. Harini Muralidharan. She is the team doctor and team operations manager for RCB women's team. She's a founder and director of the Performance Doctor Institute. She did MBBS at Savita University in Chennai, Masters in Sports and Exercise Medicine at Queen Mary University of London. Founder and director of the Performance Doctor. She's a team doctor for RCB, worked as a team physician for the New Zealand cricket team. She's a sports physician in Geeta Medical Center in Chennai. She's also a team physician in LA Royal Kings for Tamil Nadu Premier League. She will be talking about the female athletic triad. So when you look into the female athletic triad, we look into how the athletic triad has evolved. So there is the whole concept started in the year 1997, and to the present day, multiple changes have happened to the extent where it is currently progressing. It also includes the male athletic triad, the consensus statement between the two, and the female athletic triad update. So we'll just have a look at what it is. It is a condition that affects the female athletes such as gymnasts and dancers. It is a syndrome in which amenorrhea, osteoporosis is insufficient, and calorie intake affects a certain group of athletes. One second, sorry. Affects certain athletes. Video. Yeah. Certain athletes, yes, sir. Each component of the female athletic triad can occur from mild to severe. Not all components need to be present, but if one component is found, the other components should be looked into and should be checked appropriately. If they find a young, healthy female with stress fractures, they should ask her about her eating habits, what she eats, what her diet includes. The physician should also examine the relationship between different components of the triad, her menstrual history, her eating habits, her exercising habits. All that has to be looked into. The eating disorder, the athlete will try to restrict their diet in order to maintain a low body fat, and that may cause an imbalance of energy. So the athlete will start feeling weak, will be unable to perform at a particular level. There'll be calorie deficit. A negative balance will be formed, which will indirectly start affecting her athletic ability. This will then lead on to other side effects or other effects in the body, leading to amenorrhea from energy imbalance. This is due to the insufficient calorie intake in most of common causes in females, and it may or may not be associated with other eating disorders. So once amenorrhea sets in, eating disorders can affect the brain's regulation of the ovaries. This may cause absence of the menstrual cycle. This will indirectly lead to a hormonal imbalance and precipitate physical and mental changes in the female's body, causing disturbances in the bone balance, causing disturbances in the muscle balance, in the performance, and in the normal homeostasis of the athlete. There are two major types, that is primary and secondary amenorrhea. Primary is the menstrual cycle, and secondary being due to its causes. Amenorrhea will, again, like I said, lead to bone calorie deficit in the form of osteoporosis. Osteoporosis will lower the bone density, precipitating the athlete to stress fractures and other sort of injuries. And this will make the bones fragile, and 90% of the mineral content will be lost by the time the athlete reaches adolescence if this is led to progress. So they should recognize the disorder, they should prevent the disorder, correct the energy deficit, increase calcium, vitamin D, maintain a positive bone mass, resume normal menstruation function by visiting an endocrinologist, and reduce proper intensity of training during these phases of menstrual cycle. Education and counseling of the athlete is of utmost importance. We'll need an athletic trainer, nutritionist, a psychologist, and a physician. The female patient will be a history of stress fractures, should undergo an appropriate workup. They should include an obtaining menstrual cycle history. Nutritional consultation should be done. Bone mass density, bone mineral density should be checked. Psychological consult should be done for eating disorders. Thank you, sir. So this is the entire script for the women's session, sir.
Yeah, I think half an hour of time should be enough for including the discussion. Here we took 20 minutes, so with discussion, I think it should take half an hour. But these presentations, our speakers itself would be getting some material. In case we want to add this presentation in between, let's have them.
Yes, sir.
So Rohit is going to do the presentation.
No, sir, this is just a script. Matilda will be handling this session.
Okay.
When